introduce myself. My name is Hashifah Noor Adiningtya. You can call me Hana. Yes, I am a college student at Health Polytechnic of Ministry of Health Semarang. And now, I study at the Nutrition and Dietetik major. So, on this video, I will give a presentation about nutrition in hypertension patient. Okay, just watch this video. Okay, the first presentation material is definition of hypertension. Hypertension is a chronic condition which the presence of blood pressure on the walls of blood vessel arteries. Increased blood pressure, systolic blood pressure more than 140 mm Hg and diastolic blood pressure more than 90 mm Hg on two measurements with an interval of 5 minutes in enough rest. Hypertension is often called to as the silent killer because it is a deadly disease without any symptom first as a warning to the patient, even if symptoms appear. Often the symptoms are considered as an ordinary disorder, so patients are late in realizing the arrival of the disease. And then, etiology of hypertension. There are two types of hypertension. First, primary or essential hypertension. Primary or essential hypertension is hypertension for which the cause is not clearly known. Various factors are thought to play a role as a cause of primary hypertension, such as increasing age, psychological stress, unhealthy consumption patterns, and heredity. About 90% of patient hypertension is thought to fall into this category. And then the second is secondary hypertension. Secondary hypertension is hypertension whose cause is known, generally in the form of disease or organ damage related to body fluids. For example, kidney failure, use of oral contraceptive, and description of hormonal balances, a pressure-regulating factor that can be caused by kidney disease, endocrine disease, and heart disease. And then, there are many symptoms of hypertension, such as headache, palpitation, chest pain, nervous, blurred vision, and tired easily. Okay, next, risk factor of hypertension. First, age. Age affects the occurrence of hypertension. With increasing age, the risk of developing hypertension becomes greater. Then the second is gender. Gender has an effect on the occurrence of hypertension. Men have about 2.3 times more risk of developing hypertension than women, because men are thought to have a lifestyle that tends to increase blood pressure. However, after entering menopause, the prevalence of hypertension in women is increasing. And then, the third is genetic. A close family history of hypertension also increases the risk of hypertension, especially primary or essential hypertension. Factor genetics is also related to salt and renin regulation metabolism cell membrane. For obesity, body weight and body mass index are directly correlated with blood pressure, especially systolic blood pressure, where the relative risk for suffering from hypertension in obese people is 5 times higher for suffering from hypertension compared to normal people. While in patients with hypertension, found about 20 until 30% have more body weight or overweight. 5. Excessive salt consumption. Salt causes a buildup of fluid in the body because it pulls fluid outside the cell to be expelled, thereby increasing the volume of blood pressure. And the last, stress. Stress or mental tension can stimulate the adrenaline glands to release adrenaline and stimulate the heart to beat faster. So, blood pressure increases. Okay, next, I want to explain about nutritional intervention. The main goals of hypertension intervention to reduce morbidity and mortality due to cardiovascular and renal complications. When the diagnosis of hypertension is made, the patient should be given education and counseling immediately to change the lifestyle accordingly. Recommendation for lowering blood pressure. Remember, nutrition education and counseling is part of the nutritional intervention. Okay, next, lifestyle modification. Based on data, the prevalence of hypertension is still very high, so it requires attention both in terms of promotive, preventive, and curative in preventing and controlling the disease. In the treatment of hypertension, it is divided into two, such as pharmacological management and non-pharmacological management. Several types of non-pharmacological intervention or lifestyle modification that need to be done to prevent and control hypertension include reducing salt intake less than 5 grams in day, eating more fruits and vegetables, being physically active on a regular basis, avoiding tobacco use, reduce alcohol consumption, limit intake of food high in saturated fat, and eliminate or reduce trans fat in the diet. And then, hypertension diet. Diet is one of the effective non-pharmacological strategies, but changing and maintaining behavior is not easy because the big responsibility of diet adherence depends on the patient, and self-care is important to control blood pressure. Evidence suggests the behavioral change intervention to control blood pressure are considered a cost-effective investment in public health. Diet costs for the people with hypertension are: first, reduced salt intake. Reduced salt is often less offset by intake of more calcium, magnesium, and potassium. The recommendation for sodium consumption from food for people with hypertension is 2,4 grams of sodium or 6 grams of sodium chloride in day. Then, second, increase fiber. Consuming more vegetables that contain loads of fiber will facilitate bowel movement and restrain some sodium intake. Patients with hypertension should avoid canned food and fast food from restaurants which are feared to contain many preservatives and lack fiber. And then the third, increase potassium consumption. Research shows that consuming 3,500 of magnesium of potassium can help overcome excess sodium, so that with an ideal blood volume that can be achieved back to normal blood pressure. Food that contain lots of potassium such as banana, orange juice, corn, and broccoli. And then 4. Increase magnesium. Research shows that a high intake of magnesium, according to the RDA, recommended dietary allowance, is about 3,500 magnesium can reduce blood pressure in someone who has hypertension. Food sources that are high in magnesium include peanuts, spinach, beans, and seafood. Next, 5. Calcium intake. The calcium content needed in daily life, which is 800 mg, which is same to 3 glasses of milk, can prevent complication in hypertension. Foods high in calcium, such as low-fat cheese, and fish such as salmon. And then the last, 6. Avoid foods high in saturated fat. Foods that contain saturated fats, such as fat in beef, lamb, and palm oil, are strictly prohibited for people with hypertension. Excessive intake of trans or saturated fat can increase the risk of obesity, which can trigger hypertension. In addition, people with hypertension are strictly prohibited from consuming fried foods because they can increase the risk of heart attack. Okay, next I want to tell you about low salt diet. Low salt diet 1 is 200 until 400 mg natrium. Low salt diet 1 is given to patients with edema, ascites, and severe hypertension. No salt is added to food processing. Avoid foods that are high in sodium. Then, low salt diet 2, 600 until 1200 mg natrium. Low salt diet 2 is given to patients with edema, ascites, and non-severe hypertension. Daily feeding is the same as low salt diet 1. In processing, you may use half a teaspoon of table salt or 2 grams. Avoid foods that are high in sodium. And last, low salt diet 3, 1000 until 1200 mg natrium. Low salt diet 3 is given to patients with edema, ascites, and or mild hypertension. Giving food a day is the same as the low salt diet 1 in food processing. You can use 1 teaspoon or 4 grams salt. Okay, in the last, I want to tell you about DASH diet. The DASH or dietary approaches to stop hypertension diet is a diet that increases the consumption of fruits, vegetables, and the consumption of processed or low-fat dairy products with a lower intake of saturated fat, total fat, and cholesterol. The DASH diet also included eating whole grains, fish, poultry, and nuts, and reducing consumption of red meat, sugar, or sugar-containing drinks. The DASH intervention diet showed a decrease in salt intake in 4-week period and was able to reduce blood pressure by 8 until 14 mm Hg. In addition, doing physical activity, no smoking, and stop consuming alcoholic beverage is also the most important factor that can prevent or control hypertension while reducing the risk of heart disease. Okay, maybe that's enough from me. The conclusion of this presentation is hypertension is a chronic condition which the presence of blood pressure on the walls of blood vessels arteries. Hypertension is caused by many factors, and then nutritional intervention in hypertension can be provided with low salt diet or DASH diet. Okay, I think this is enough from me. I hope this presentation can be useful. Thank you for your attention and see you.